Good evening. At this time with COVID-19 and this current pandemic we're all living in, it is so important for healthcare providers and people who want to go in the healthcare field to know exactly how to protect themselves and protect their patients. Tonight I'm going to be talking about preventing disease transmission. My name is Katie Yesvo. This evening I'm going to be talking about hand washing, a little bit about the history of hand washing. I'm also going to be talking about donning and doffing PPE in the field. Hand washing began back in 1846 with Ignaz Semmelweis. Ignaz Semmelweis was a Hungarian doctor, and he realized that in this facility that he was looking over, that his doctors that were in training, they had a high mortality rate in the maternity ward. In this maternity ward where they're giving birth, these student doctors were providing care, and the mortality rate was way up in the sky. And then next door at a different facility, some midwives were also doing the same thing. They were also helping women in labor, and their mortality was so much lower than where the student doctors were at. So Ignaz Semmelweis decided to set out to figure out why this was happening. Ignaz Semmelweis came to the conclusion that prior to these medical students helping these women in labor, they're in an autopsy lab where they were handling dead bodies. And they weren't washing their hands prior to helping these women give birth. Ignaz Semmelweis decided to implement hand washing and have these student doctors wash their hands with chlorine bleach before helping these women give birth. He found in his study that the mortality rate just plummeted and that hand washing worked with helping save these women's lives. So Ignaz Semmelweis was the first person to ever introduce hand washing in the medical field. Unfortunately, this is according to globalhandwashing.org, and unfortunately, the world just didn't accept his findings that he had found. The world just wasn't ready for hand washing yet. Next, a woman by the name of Florence Nightingale, in the year of 1854, she was a nurse, and her and a team of 38 nurses during the Crimean War were sent to a facility where there was a lot of injured soldiers from the Crimean War. At that time, 40% of the injured soldiers that came into this facility would die. And there's lots of complaints about unsanitary conditions, overcrowding, and lack of medical supplies at this facility. So her and her team were sent to this area to go fix the problem. And when they arrived, they implemented sanitary practices with all the doctors and the nurses. They implemented hand washing. And within 6 months, the mortality rate at this facility dropped to 2% in only 6 months. This is according to the womenshistory.org. And her findings were, incredible. So that was the first thing. Following the Crimean War, she published an article saying, showing her findings. And then finally, the world started accepting hand washing. Today, the CDC.org recommends that people wash their hands for at least 20 seconds, and they use hot water, and they use lots of friction, and you make sure that you cover every surface of the hand prior to being finished. Make sure you get the end of the fingernails and all this stuff prior to being done with your hand washing. So next, we're going to be talking about PPE. PPE is very important for droplet and airborne protection of infectious disease, and there's a certain a series that one puts on and takes off PPE in order to protect oneself from infectious diseases. So first, when donning or putting on PPE, somebody needs to start with obviously washing their hands. First, you need to wash your hands prior to going into any patient's room. Next, so I would like to note that this PPE is for training purposes at my work. I am an EMT, and I have been an EMT for 3 years, and my work was gracious enough to let me borrow their training PPE for this service, and then we'll go back to our training room for further training with our other EMTs. So after washing our hands when applying PPE, we put on a gown. The gown has to go from wrist to neck, all the way up to one's neck, and all the way down to our knees, and then a tie is attached in the back of the body. We'll just pretend like I tied this back here for teaching purposes. Next, a mask or a rescue mask would be applied, or a respirator will be applied to the face. Today I only have a mask. A respirator includes N95s that you've probably heard about on the news, that kind of thing. Then you apply your mask when donning your PPE. Next, one would apply goggles. We supply goggles at my place of employment. But in this case, we're using a face shield. Use goggles or a face shield. Next, that would go on one's face. I'm going to go ahead and leave it off so I can continue to speak. And then next, one would apply their gloves. When applying gloves over the top of PPE, be sure that your glove goes over the top of the gown snugly, as to not to have any infectious disease come in contact with your hands or your wrists, or anything like that. Okay, so when I have my mask and my goggles on, now I am ready to approach a patient with possible infectious disease, okay? So prior to ever leaving the patient's room, we have to doff our PPE. Doffing means removing our PPE in a specific order. CDC.gov recommends doffing PPE in this specific order. First, one would remove their gloves. In order to remove your gloves, you try not to touch the surface of your skin. So the first glove is removed by pinching the outside of the glove, slowly removing it into a ball, as to not have your hand be contaminated. Try not to fling your glove or flip it or anything like that in order to get infectious disease into the air, so you could possibly get it anywhere. But do remember, I do still have my mask and my face covering material on. So next, after I have my glove securely in the other glove, I carefully, without trying to get my hands infected, try to turn my other glove inside out, in on itself. Then I have a nice little bundle here that can go directly into my biohazard bag. All used PPE goes into a biohazard bag that would be red and properly labeled on the front, biohazard. So I would put my gloves in my biohazard bag. Next, I remove my goggles and my face shield. That would have been on my face, around my ears, the entire time. So I carefully remove my face shield, trying not to get my hands contaminated, trying not to flick my face shield. If I had a respirator on, an N95 respirator, this will remain on until the last step. This would also go into my biohazard bag. Next, I would remove my gown inside out. I would undo my ties that I previously tied, right? Untie my ties as best as possible, try not to get my hands soiled. Slowly turn my gown inside out. Try not to soil my hands. Slowly roll the gown up inside out. Also put into my biohazard waste receptacle. Lastly, if I had a respirator on my face, I would remove that last after leaving the patient's room. This is very important. All PPE is removed in the patient's room except for the respirator. The respirator is removed last, placed into a carefully marked biohazard bag. Biohazard bag is closed, hopefully tied closed, maybe with a zip tie or tied closed. Returned into wherever this receptacle where the facility deems it necessary. And lastly, one always washes their hands after removing PPE. Okay? Well done, everybody. Thank you so much. Today we talked about washing hands, donning and doffing PPE. Everybody stay safe and take care. Thank you.